want you to look amazing. So. Hi, everyone. Welcome. We're going to get started in just a minute or so. We're just having some people just doing some connections. So my name is Heather Leeson, and welcome to Open Data Day. Really excited today that we can talk about open gender data, specifically in Tanzania. Now, it's been about 3 or 4 years since I went to Tanzania, so I'm super excited. That was Phosphor-G, super excited to be here with you to learn what your progress is and what you're working on. And really also excited to see so many women leaders who are speaking and joining. So those of you that have just joined, we're just going to take another minute or so. In the chat, if you could write your name, where you're from, and what gets you excited about mapping or gender data, either one. We just want to get to know who's in the room with us, right? And just kind of have a shared circle, because it really is a special day and a shared circle with all of us here. And to be honest, again, I feel really privileged because I'm not from the continent of Africa, nor am I from Tanzania, but I certainly get to be a listener here. So I might have lots of questions for you. So don't be shy as you're putting your name in the chat. It's just at the bottom of the Zoom screen. If you put your cursor over the bottom of the screen, you'll see something that says chat. If you click on chat, then you can type in what's called the chat box, and then you can write your name in that, name and where you're from. If you're not comfortable telling us where you're from and stuff, that's okay too. We just want to make sure that we have a shared conversation with you. So I think that we have finally got everybody who was in the waiting room in the room here. So what I'm going to do now is just do a quick introduction, and then I'll hand over to Janet Chapman, who will also give an introduction of each of our speakers. We're just going to tell you who we are, where we're from, and why we're crazy about mapping or why we care about gender data very quickly around the room, okay? And then we'll have some presentations from my colleagues. Following that, we'll have a Q&A. So I want you to make sure that if you do have questions, this is our conversation. It's our journey. So we really want to know what you think. And so if you want to message directly in the chat, or you want to direct message Janet or myself, that's perfectly fine. But again, just a reminder to enter the chat bot, you put your cursor over at the bottom of the screen. There's a little thing that says chat, and you can add in your questions or comments. Since we are a smaller group underneath 20, we could also work on coming off mic and talking with each other. But for the now, I'd ask everybody to be on mute, because that way we'll help with echo. If you find that the video is too much and it affects your bandwidth, please let us know, because we will just turn off our videos and have only the speaker on. So in the meantime, just make sure that we know as your hosts that you're having a good experience and that we can hear from you. So again, more than welcome to put your name in the chat. So my name is Heather Leeson. I've been involved in Open Data Day for well over 12, 15 years. Even before I became involved in humanitarian response, I was involved in open data in Canada. I'm very, very excited to see how open data has progressed and how there's open data days continuing to happen around the world. What I also think is really exciting about open data is that it's something that connects us into this shared conversation about whose data, my story. And so I'll tell you a little bit more about that later, but I just wanted to let you know that my name's Heather. Really glad to have you here. And please, again, if you can, put your name in the chat and where you're from and what makes you happy about mapping. And we'll turn to Janet.
Hi, thank you. So I'm chair of Tanzania Development Trust, which is a volunteer-run charity that's been supporting grassroots projects in Tanzania for 45 years. I've been involved as a full-time volunteer for the last 9 years. And in the context of visiting some of the communities that we work with over those years, realized that the fact that they were not on any map was a huge issue, particularly to FGM activists like Revi Stirling that we work with. So 5.5 years ago, I started Crowd2Map, which has been mapping rural Tanzania into OpenStreetMap from satellite imagery, but also using things like maps.me and so on, and enabling communities to map their own villages, etc. And as part of that, we also set up digital champions in each of the villages where Robi and the FGM activists are working. So we've been involved, having organised Open Data Days for the last 4 years, I think. This time last year I was in Dar es Salaam, so it's not quite the same being online, but it's really great to be here, and thank you to everyone who agreed to speak particularly, but also to come and hear. Thank you.
Wonderful. Thanks, Janet. Teresa, tell us your name, where are you, and what gets you excited about open data or mapping, either one.
Yeah. Hi, everyone. To us in Tanzania, it's good evening. I don't know about the rest, but it's good day to everyone. Again, my name is Theresia Numbi. I'm the CEO of Lighthouse East Africa Legal Clinic. What we do, we provide legal services to micro, small, and medium enterprises. And for me, I'm very for the past like 4 years, we're very interested with working with farmers. When we talk about farmers, I'm referring to farm organization, of which we have managed to work with almost like 201 farm organization from 8 regions here in Tanzania. Apart from that, I'm also a assistant lecturer. I'm teaching law in one of the best universities in Tanzania. It's called Tumaini Salaam College. So I'm also very excited because this open data is just an open area to see how these things have been done. And today I'll be sharing you the journey that my organization, I have done in the role of women in agriculture. So I'm looking forward to this excited event, and I can't wait to share that. Thank you.
Thanks so much, Teresa. Mahidia, tell us, where are you and what gets you excited about open data? And about you. Hi.
Hello, everyone. So I am Mahadia Tunga from Tanzania, East Africa, Tanzania Data Lab. I'm the co-founder and director of capacity development. So about open data for me, because I'm really working on the gender space, especially on aspiring more women to become data scientists. So with the open data, the fact that it exposes the biasness, so we need the data to make informed decision, even as a gender activist, to have that evidence-based decision. So that's what excites me about open data.
Wonderful, wonderful. And how late is it where you are calling from? What time is it there?
So here it's 7 p.m.
Right, it's 5 p.m. here where I am in Geneva. Wonderful.
Oh.
We'll see, because I think there's people from around the world on this group, but also who are joining us, which is always really exciting. Revi, tell us.
Hi, I'm Revi. Habari gani, karibuni, naipenda Tanzania, na Zanzibar. It's wonderful to be here. I am a huge advocate of Janet's tireless work with all of the mapping she has done. And at USAID, where I run the WomenConnect Challenge, we've been able to help support that in small ways that I hope all add up to meaningful work. And I will be setting sort of a stage of sort of gender digital divide before everybody gets into their wonderful stories about data. But I truly believe that if you can't count women and locate women, you can't make women count and have their experiences shared. So this is perfect. Happy International Women's Month to everybody.
Yeah, Women's Year. Let's just make it every year Women's Year. Yeah, let's just take it all. Annemarie, tell us.
Hello, everybody. My name is Annemarie Middelburg. I have a PhD in the fields of FGM, and that's also how I got to know Janet. We are working together since a few years now. Since I have a PhD, I work a lot with data, although my research is a lot focusing on qualitative data. I use quantitative data more and more. So I will also present you the DHS and mixed surveys and the data that is publicly available on female genital mutilation. So I have a background in human rights. I also teach at the University of Amsterdam. Yeah, so that's me. And I look forward, I really look forward to this event. So thank you also for your invitation.
Wonderful. And thank you, Annemarie. You are hearing beeping for people joining us. There is a setting in Zoom to change that. We'll figure it out ourselves. So just bear with us. Just think of it as exciting people joining you just in the middle of the conversation from the digital hallway. That's the way I look at it. Raya, please introduce yourself, my friend. We can't hear you. Maybe no headphones, friend.
Yeah, well, okay. Good evening, everyone. I'm Raya Ahmada. I'm an assistant lecturer at the State University of Zanzibar. So I'm basically coming from Zanzibar, Tanzania. But I have also worked as a Resilience Academy internship program coordinator at SUZA side under the Tanzanian Urban Resilience Program. where I gained the interest of working with data, because it's since then I have been working with students, mentoring them in different activities regarding the open data. And I have been their mentor in the Data Visualization Challenge, which is part of the Resilience Academy. From there, then I initiated the SUZA Youthmappers chapter at SUZA, and I'm their mentor there. And the journey didn't stop there, because I basically was interested in working with the students as well with the open data. And then I applied for the regional ambassador. So now I'm a regional ambassador for Tanzania. So I'm still working with the data, and luckily today we had an activity on open data and environment, in the morning.
Wonderful.
So yeah, I'm really interested because I'm working with the students, motivating them and showing them, share with them opportunities that are available, and in using the open data in solving a real world problem that exists into our society. So yeah, thank you.
Wonderful, Raya. Thank you so much. We are missing one speaker. So we'll see if Laura is joining us. Naledi.
Hi everyone, I'm Naledi. I am based in the UK, and I am a data analyst for the United Nations Development Programme. I have a background in social research and in psychology. And for the past few years, I've been working with different charities to use data to allow them to have more impact. So open data is really exciting because I think that it's the solution to a lot of problems, or at least can get us towards solving a lot of really important issues.
Wonderful. Welcome. And again, our apologies that one of our speakers is not here for introduction. She might be in another event. It is jam-packed, as someone did say. So, when we think about open data, there's this open data definition of what it is. There's the activities that we do and what everyone's going to be talking about here. And then there's this shared experience. Now, I come from the OpenStreetMap community, specifically as well as humanitarian OpenStreetMap. And I've been involved in community engagement and data for many, many years, including data literacy, different social innovations. And every single time someone talks about open data, my first sentence is, data is about people. It's about the people before the data. So as much as open data is really important, data is also about power. It's about storytelling. It's about feelings. It's about what connects us and our world. It's about making sure that it's not treating our world like a data buffet. And what I mean by that is that every single one of us has an opportunity to use open data for the impact that we have. And so I have been driven by that in my career. I work at the Red Cross Red Crescent Society, specifically on data and digital. We're interested in making sure that data stays in the local countries, and that the people who own that data, who made that data, that they have the decision-making power to do it, but also the skills to do it, but also more importantly, that we learn from them. And so that's probably the most speaking you're going to hear from me today, except for the questions. But I just wanted to say that there are some stories here that people will be telling you about the different angles of their data journey. And I hope that that you know that you're part of that impact. And that what I'm also excited about is that there's many women speaking here. So please invite them to your sessions and your communities, and just know that each of you are part of this community that has been connected today, and that bond is really important. So if you are just joining us in the chat, please put your name, where you're from, and what gets you excited about mapping or open data. And let's kick it off, because we're 17 minutes in, and I want to get to the heart of this and learn from our presenters around their journey on open data and gender data. And then again, we have some time for questions. So if you do have questions, please do put those in the chat. We'd be so happy to hear from you. And questions or comments are welcome. I know that's very chatty of me, but I do think that there's a lot that comes in the power of this room. So first up is Revi. Tell us, you're ready to share your screen? You're on mute.
Let's unmute. Let's share the screen.
Love it. Over to you.
On screens? Are we good on screen? You never know these days.
All set as you were.
Wonderful. Well, I'm starting this for 5 minutes only because I want to hear from all the other wonderful women who are working here much closer at the data gender angle than I am. But I'm delighted to kick this off and give just a little bit of a background, kind of where we are in terms of the gender digital divide. By way of introduction, as you can tell from my terrible Swahili, I did my PhD work on the border of Kenya and Tanzania back too many years ago to really count, and East Africa has a huge place in my heart. So I'm delighted to see friends and new friends from all over. I'll talk a little bit about the fact that, you know, when we're talking about mapping and we're talking about women's empowerment, let me move my slide here. My slide doesn't want to move. You know, I really believe, you know, as a technologist and as somebody with, you know, degrees in computer science and feminist research methods together, you know, that there are really two multiplying forces in the world right now, especially in development and empowerment. And one is technology and one is women. And unfortunately, the two seem to fail each other all the time because we do such a terrible job of making sure women's voices, needs, information wants, and aspirational desires are part of the technology that we're providing. And, you know, what I'll just say is the last time I was in Tanzania, which was about a year ago, thanks to COVID, I was doing some surveys, just some data work outside of Dar, and found in one of the communities, I talked to 1,004 women, and, you know, and I'd say 30% of them across the board said, I have no restrictions with my phone. I can use my phone anytime I want. I don't need anyone's permission. And in the same community, 37% of the women said, I always have to get permission to use the phone. I always have to get permission to use the internet, or my husband/father doesn't let me use it at all. So this is just in one community that looked fairly homogenous, et cetera, but it just shows that data at literally the level of individuals is what we really need to understand. Okay, what is this huge difference even in this one community alone, where 1/3 of the women are completely free to use technology and 1/3 are still incredibly hampered. And my take is that if we don't have equitable development, especially in digital development, where all of the sectors, ag, education, health, are running towards digital strategies, if we're not specifically looking at women and their data, needs, their information needs, et cetera, then we're not doing, you know, equitable development. We're not doing development at all. This is pretty well known of a fact. You know, we've known for 20 some years, as long as I've been in this you know, this sector of development, that there's all sorts of barriers to equitable women's participation in the information society. What I mostly do is work on this social norms level, which I think is always ignored because people go, oh, it's cost, it's literacy. And really underlying all of that are just the inequities in society that make it so women can't afford, don't have the same purchasing power as men, and don't feel like they are smart enough or relevant enough to use information technology, when in fact they're probably the ones that need critical, accurate information more than anybody, because as we know, the key to sustainable development is investing in women's empowerment. And this is a community network we put up that's all women run and managed up in northern Uganda, up in about an hour north of Gulu. Some of the questions that I always lead with, and perhaps these are things that, you know, you might either you are doing or might want to add to your research and practice methodology, is trying to understand where are those women that still aren't enabled to use technology for their own empowerment. Under what conditions might they be able to? I've worked with a lot of communities that have outright banned women's internet and cell phone use. Either it's a local fatwa or it's a mandate from the local government, et cetera. And how can we use technology to actually open up new avenues for women in technology? So this community in Patongo, Uganda, had never even had internet or electricity, but women brought it in, and the men were so happy. There just weren't those gender norm issues that would have happened if men had been the ones to bring in the internet and the electricity. And then I want to lead, of course, with HOT, because leading with a societal problem, a huge issue like FGM or land rights or any of the many things HOT does can really drive women's empowerment and adoption. I'm officially almost out of time, so I will, I do want to stay in touch with anybody that wants to talk about any of these things, but there's a huge evidence base in what works in closing the gender digital divide. Here's a few things, leading with mobile money, which is of course highly successful in Tanzania, helping people. We've been running a program in Tanzania with Viamo on just letting women build confidence around using technology. What is this internet thing? What are the social networks I should be using? How much does it really cost to have a smartphone versus a feature phone? Oh yeah, that's me. Stop phone. Sorry. But these things only really work if we focus on these social norms that are so important, and creating on-ramps to women's safety online, economic activities online, respect and dignity opportunities that we can bring to women. So I will I'll make my slides available and would love to talk at any time, but the rest of the speakers can, I think, hopefully build on this as sort of the landscape of the gender digital divide and how gender data is really going to help us close a lot of these gaps and create more opportunities for women. Anyhow, I've loved chatting. I'm going to shut up because the other women are so much more important and engaged in this at a local level. So wonderful to talk. And I will put my email address right here. It's revi_sterling@dai.com. This is my life. This is my passion. Let me help you out. Let me learn from you, and let's be new collaborators.
Wonderful, Revi. And just again, really a really great kickstart to our conversation today. When we talk about women, there's many women and men and allies in the room here. And I think one of the most important things we can do is meet somebody who might need mentorship or give mentorship to somebody, right? And so it's really important as we think about how we do our work, to consider how we can help each other. I know that sounds really strange coming from me, but I think that's the most important thing we can do on this journey, is to, one, recognize the leaders, but also help each other. So next up is Naledi, and she's going to have a little bit more of a chat around some of her research. So Naledi, please go ahead.
Am I sharing my screen?
No, Janet and I are taking care of it for you guys. Don't worry about it. We got it.
Okay, great. So as I said, I'm Naledi, and at the moment I work on the, sorry, I've lost my, I've lost you guys, but I want to see your faces as I'm presenting. So at the moment I am working on the COVID-19 Data Futures platform with UNDP, where we bring together data and analytics for governments, donors, the general public, anybody who's interested in open data for recovery, for the socioeconomic recovery from COVID-19. But before that, so next slide, before that, I worked for a charity that helped women with obstetric fistula. And obstetric fistula is a condition that women can get if they give birth, but they don't have adequate access to the medical care that they need, for instance, a C-section. And it's said that there's about 1 to 2 million women in the world that have an obstetric fistula. And from that, we can already see that there's a huge range in that, which tells us a lot about how little we actually do know. So in Tanzania, for instance, this visualization shows us that they estimate that there's around 2.1 per 1,000 women of reproductive age who have a fistula. Now, that doesn't sound like a lot, but that is still 21,000 women who have an untreated condition that is really impactful on their lives and can really diminish their quality of life. And this is based on a survey, not a medical diagnosis. It's based on a national study where they interviewed about 10,000 women, and around 33 said that they currently had symptoms of a fistula. So again, the estimate of the actual impact on women in Tanzania is between 10,000 and 35,000 women who currently have a fistula. So if you can go to the next slide, we need a lot of different data to answer this problem. Where do we find the women? How do we know how the distribution looks like across a country, and where we need to focus our efforts to try and get the treatment options to the women and see if they want to have the treatment or what we can do for them? What can we do to prevent further women from having this injury? How can we offer more medical services, or are there other factors, maybe social factors, that are leading to them getting this injury? And how many are there? We need to know how many surgeons we need, how many facilities we need. There's a huge difference between treating 10,000 women and 35,000 women. So there's a lot of different places that we can get that data. And if you can just click through, that will slowly appear. Thanks. So we've got national statistics. Oh, one back, please. Thanks. We've got national statistics that governments hold, and there's rarely anything on fistula. It's such a small area for them, and it's so hard to track that it's hard to get data from governments, and they might not even be very willing to share it even if they do have it. We've got national surveys like the DHS and MICS that have already been mentioned that give us a lot of context information, or can even allow us to use other indicators to understand more about fistula. Academic research is hugely important. It gives us a lot of information about fistula, how we can treat it, the different impact factors, but they're very small and focused. And a lot of times they're behind paywalls, and small charities just can't afford to buy them. And then we've got medical records, which of course in all the hospitals where fistula patients are treated, they will keep their own medical records, but very difficult to get those, and of course not very standardized. So if we can go to the next slide. There are some initiatives to try and fill that data gap. So Direct Relief, for instance, they have a database of facilities that they know treat obstetric fistula, surgeons that are focused in this area. And every year for the past, how many years, they write to these facilities and ask them really high-level questions about how many beds do you have, how many fistula patients have you treated this year, how many surgeons do you have? And they're really struggling to get responses. So this is a dashboard that shows us that the engagement is actually very low, and even like the efforts that we have. In the charity that I worked in, we focused on the patient records. And the idea was that we would bring together patient records from across the world and build up a database that we would be able to share with other people working in the fistula sectors, so that they could have access to really high quality data. And it's a huge undertaking. And there were all these issues of digitization, getting facilities to switch from paper records to entering their data on a tablet, getting them to use the same form, the same questionnaire across an entire country or across the world, when of course they were used to their own questionnaires and their own data that they were collecting. And then of course patient data is so sensitive and needs to be protected, and getting really informed consent from women who are often illiterate can sometimes be a little bit tricky. So but the idea behind it is if you don't have the open data, if you can be creative about how you can get it, and you don't necessarily need to be creating your own, but sometimes that is the way forward. And I believe that if there was high quality, easily accessible data available on obstetric fistula, it would really contribute to the eradication within the next few years, and that the same is true for a lot of other issues. So I'll pass on to the other speakers who can tell us much more about Tanzania and the context in Tanzania, which I'm really excited about.
Wonderful, thank you so much. From this presentation, you know that there's such an impact in the granular data and the quality of data that's collected, and the communities that share that quality data is super important to make sure that they can help on their own health journey. When it comes to health, we haven't even begun to figure out how to use open data in the way that we might be able to in the future. We've got some pieces, but I think there's a lot more that can be done there in terms of thinking about healthcare opportunities. So next up, we have Annemarie. Thank you so much, Janet. Over to Annemarie.
Thank you, Heather. Thank you so much. So in my presentation, I will focus on data that is available in relation to female genital mutilation. So as all of you know, female genital mutilation is a practice that is widespread in Tanzania. And the question is there data available? Can you use that data in order to inform policymaking, to inform NGOs, and to use that data in order to achieve in the end the Sustainable Development Goals and reach the goal that there is zero FGM in 2030.
Wonderful. Annemarie, sorry, this is Heather interrupting. I do apologize most humbly. We want to hear your beautiful voice. So I'm wondering if you could speak up or even hug your computer, if that's all right.
Okay, I'm going to move my hat a bit closer to the mic.
Love it. Love it. Thank you so much. Yeah, much better. Thank you.
Okay,
thanks everyone for asking.
So I will speak about the DHS and mixed data. So there has been several DHS and mixed surveys also in Tanzania. Next slide, please. So first, what statistical data is available on FGM in general? Can you, yes. So we have two sources, the DHS and the mix, as I said. The DHS has been conducted in Tanzania for multiple years, and there is an FGM module in the DHS 4 times now, and I will show some trends over time, because that is of course very nice. If you have multiple years where data is collected, then you can show an increase or a decrease of the FGM prevalence. Now, the DHS defines the prevalence of FGM as the percentage of girls and women of reproductive age, so they are aged 15 to 49, who have experienced any form of FGM. So that is the definition that is used by the DHS and also by the mix. So that is actually what we're looking at. But of course, if you want to know whether a program or interventions or education or awareness raising campaigns have been successful, you actually want to know the prevalence of FGM among younger generations, among girls. So since recent years, they also started to include questions in the surveys about the daughters. So women and young women and girls who are 15 to 49 years are the women who are surveyed, and they are asked about the FGM status of their daughters. And that's how we also get daughter data more and more readily available. If we talk about the data that is available all over the world, we have the DHS and mix in 27 countries in Africa and in Yemen and Iraq. But as we know, FGM is prevalent in many more countries. So it's really, for those countries, a problem that there's no nationally representative data on FGM available. But for Tanzania, and that's what we are focusing on today, we do have important data, and I'm going to show you some insights. So what do we know about female genital mutilation in Tanzania? Well, as you can see here in the graph, you see a decline, and this is really remarkable if you compare it to the data that is available for other African countries. So on the bottom, you see 1996, 2004, 2005, 2010, and 2015, 2016. So these are the years when the DHS survey was conducted. There has been one mixed survey in 1996 as well, but that survey didn't include questions about FGM. So I only included here the data that we have of the DHS. The most recent report you see here, I took a print screen, it's 2015, 2016. I also included the link. So if you're interested, you can click on the link and scroll down to chapter 16, where you can look yourself to all the data that is available on FGM in Tanzania. I'm going to share with you some highlights of that chapter. So next slide, please. So here you see first figure 16.4, which is an overview of Tanzania. And you clearly see that the prevalence of FGM really is scattered. So you see that in some regions, the prevalence is really high. Well, in other regions, the prevalence is really low, like less than 1%. So that is something that is very common in all African countries, but it's very good to realize that that is the case. In figure 16.1, you see the type of FGM that women reported themselves. So you see that the overwhelming majority of the women in Tanzania who have undergone FGM had a type 2. 81% had cut and flesh removed, which is qualified as a type 2 FGM by the World Health Organization. 3% had type 1 and 7% was infibulated, which is the most extreme form of FGM. And 9% didn't know or the data was missing. Next slide, please. So what we also know is the age at circumcision, and that is also quite interesting. You see in Tanzania, according to the latest statistics, that women or girls either undergo FGM when they are really young, so as a baby, that is 35%, or when they are 13 years and older, and that is 27.6%. In the middle, there's not that much, as you can see in this overview. So if you go to the bottom, you see the total amounts, and that is where you can see at what age women or girls undergo FGM. The last figure I want to show you is the attitudes about FGM by circumcision status. So here you see that the percentage of women aged 15 to 49 believe that circumcision is required by religion is 15% among women who have undergone FGM, but only 2% of women who haven't undergone FGM. And then of course, a very important last question is the question whether circumcision or FGM should continue. Only 13% of the circumcised women believe that it should continue, and only 1% of the women who have not undergone FGM believe that it should continue. So this is just to provide you some insights in the data that is available. This is the data I took from the DHS report, but also the DHS data is available. You need to file a request, but very often this request is granted, and then you have the complete data set and you get more, you can disaggregate and play with the statistics even more. That was actually what I wanted to share with you. So thank you a lot for your attention, and if there are any questions, feel free to ask.
Wonderful. Thanks, Annemarie. So yeah, please do put your questions in the chat. We're going to have a moment afterwards. I just want to take a deep breath and roll my shoulders. That is a very hard conversation to have about the lives of women in Tanzania and other countries whose health issues, including who may have had FGM, what their experiences are like. So again, remembering that there's people before data, and just recognizing the fact that there's a lot of stories and lives behind there. So I think the thing about open data that really always impresses me is that it really does show what the world might look like, or what it looks like, and the change that might happen, and that takes a long time. So thank you so much. Now I am going to open up the slides for Raya. Raya, are you all set? Can we hear your voice?
Okay, yeah.
Okay, just 1 second. Let me get your slides up. Okay, and we'll take a turn. So 1, 2, 3. Presentation mode. Okay, over to you, Raya.
Thank you. Okay. Good evening, everyone. My name is Raya Idrissa Ahmada. I'm an assistant lecturer at SUZA. I'm also a regional ambassador from Youthmappers, and I mentor one of the chapter at SUZA. And I'm also the founder of Mshauri STEM initiative with the aim of motivating young students, especially girls, to like STEM related fields and STEM related career. So my presentation is basically going to focus more on what is open data and what we mean by when we say open gender data. Because when I was invited in to prepare this presentation, I believe that most of the people who are going to join are going to come from Tanzania, and I expected for them to be, most of them to be students. And that's why I will focus on that side. Now, the side that I will focus in how we are going to collect and contribute to open gender data. So I'm not going to share the data, but I'm going to share the insight of how we're going to collect open gender data. Next slide, please. Next slide.
Sorry.
That's okay. So now, basically in here we have two main questions because we are talking about open gender data, but does everybody understands about open data? So what is open data? And open data is the data that can be freely used, modified, and shared by anyone for any purpose. And it is technically, legally opened. And by gender, this is sex segregated data, and it is socially constructed in the differences that are attributed and opportunities associated with being a certain gender. So that is the meaning of this. But by open data, the data has to be for everyone, and that data needs to be what people need, and the available data can be easily used. So by open data, there are some categories that needs to fit in. Next slide, please. Okay, thank you. So now what we mean by gender data. So gender data is sex segregated data, which cover demography, education, health, access to economic opportunities, public life, decision-making, and agency. And the World Bank defined this as the gender issues that affects women, like maternal mortality, informal work, education, and other social determinants of wealth, well-being, and empowerment. So that is how it's being defined by the World Bank. Next slide, please. Now, do we actually, on our focus, the focus is in Tanzania, do we actually have open gender data? We actually have, there's a gap that exists, and there are some various reasons that have added to this lack of data or gender data gap. And some of them are the lack of prioritization by government and society. Also, there's an insufficient of financial resources. Also, there's biases in data collection and recording, as well as unsafe spaces for girls and women to report their experiences. So now we need to take into consideration that whenever we are collecting data and we are contributing to the open data, we need to take into consideration the gender segregated statistics into account, so that this data could be used in making decisions by the government and other ministry in particular. So the experiences and needs of girls are hidden, and they are not clearly represented in programs and policies, because the reason why is that when people are collecting open data, they are contributing to open data, but basically most of them, they don't give this gender perspective into play. Next slide, please. Yeah, so as we have said, open data needs to be for everyone, and for the data needs to be what the people actually need, and it should be easily used. So we are saying if any of this is not met, then it means open data is still not open. In our side, for example, in Tanzanian side, especially Zanzibar, it is really hard to find open gender data statistics. So most government data is still not open, particularly. And the open data that is available is not actually what people need, because we need open data in order to improve our lives, in order to solve the existing problems in our society. So there's open data. Most of the time it is it is in silos everywhere. It is not in one place, but it is really hard to understand the data that is available, because there are some data with which doesn't have enough metadata for someone to understand clearly what that data contains. Next slide, please. So how we are going to harness the power of gender data? So we need to make it possible to bridge the gap that exists and address these inequalities between gender rights from childhood to sharing power and decision-making at all levels in society, making sure that we are not leaving anyone behind. So in this sense, when we are collecting data or when we are teaching people to collect data, we need to make sure they take this into consideration. Some of the good examples that I found in Tanzania is what the Crowd2Map, Miss Janet Chapman, she's doing. I have read some of the activities that she has performed, like the one that I listed here, the 16 days of activism against data-based violence in Tanzania, which is conducted, I think it is in 2018, and then the Training Village Women and Children Protection Committees in the WomenConnect project, which was basically fit into this creating open gender data. And there's another program, the Let Girls Map, which basically in the beginning of the process, it makes sure that it doesn't leave anyone behind, and the girls are given power to address their issues in collecting the data. Next slide, please. So actually I have here as an example, last year I was working with the Resilience Academy, the program that I was working under the Tanzanian Urban Resilience Program. And we actually wanted to look at the schools data that was available in Zanzibar for both islands, Unguja and Pemba. And what we basically found is that in Unguja, in Pemba, there was only one available school in the OpenStreetMap, and in Unguja, there are a few mapped schools that were available. And then when I talked to the Ministry of Education and Vocational Training in Zanzibar, we got some statistics that were available. And when we depicted them into the QGIS software, we could see there were a lot of different schools, but these schools also miss some of the attributes, like, for example, the number of female students in each of the schools. We couldn't get that data. So the data was there, but it was not open. In addition to that, it was missing some of the gender-based data into it. Next slide, please. Yes. And then when we looked into one of the research, which was accessing poor performance in Zanzibar, it was explaining that they need data like the one I have told you, the number of female students, the number of boy students, and this data was actually coming from the Zanzibar Ministry of Education and NECTA. So finally, we have the last slide, please. So we have a very long way to go. And to help into this, we need to make sure that we generate more gender data by training the people who collect data in the beginning of data collection, that they need to take gender consideration into account, and also opening up existing data so that it is free and available for anyone to access and use. And that data should conform to open data and global standards so that everybody can understand what is inside the data. And we should build the national capacity of national actors. This is some of the things that I propose that we do. And the last slide. So thank you very much. And this is my contacts. You can contact me through that email. And that is my linked account, Twitter and Facebook. Thank you for listening.
Wonderful. Wonderful. So just Raya's given a really strong call to charge that when we're talking about whose data, women need to be involved, women and girls need to be involved in shaping that data, but also advocating the data. And I think everybody should be advocating for equal data and data that reflects the whole society. Women are 50% of the world. Anyway, preach it, sister, I'm sure. But I just want to say thanks, Raya, for the strong case and for building out an example of how you've done that in your communities in Tanzania. So thank you so much. Next up is Teresa. Teresa is going to tell us about gender data for women in agriculture. I know my grandparents were worked on farms when I was a kid. So let's hear a little bit more about how agriculture and women and gender data can have an impact. And don't forget, if you are joining us a little bit late, please do put your name, where you're from, and what gets you excited about data in the chat. And if you have questions for any of our speakers, we're going to have some question period pretty soon. So over to Teresa, and thank you, Janet.
Oh, hello, everyone. I hope you're all having a very wonderful day. And thank you for my fellow presenters. They did a very good job. And I'm also very grateful for Raya, who has presented a lot in the Zanzibar perspective. Again, my name is Theresia Numbi. I'm an assistant lecturer at Tumaini University. I teach law. I'm also a CEO of Lighthouse East Africa Legal Clinic. What we do is just provide legal services to small and medium enterprises. And for the past 4 years, my clinic has been focusing on empowering and providing legal support to our small farm organization. And today I'm having a very interesting topic of which I'm going to share gender data for women in agriculture in Tanzania. Again, we know that in Tanzania, women take a large part in agriculture. Most of the work that is being done in agriculture is done by women. According to the open data that we're having is that in Tanzania, 90% of women are involved in farming activities in Tanzania, especially in rural area. However, not only that, women spend like 67% of their time in farming activities. I talk about this timing that women are involved is very, according to the open data that I got, is that during harvest time, for instance, women spend like 70% of their time compared to men, while during wedding, the women can spend at least, again, to 7%, while men who are the source of income provider also participate only 30%. And not only that, during sowing, again, we see women take a very lead whereby they participate almost 74% comparing to men who participate only for 26%. And again, very interesting in terms of food cropping production, during production, we see that according to the open data is that women do participate or contribute much of their time, almost 57% compared to male who only provide for almost 40 plus. And I talk about in the general crop production that even we talk about the involvement in male is very less compared to women, whereby male only involved in 44%, while women contribute to almost 56%. So general in total, when we talk about participation in women in terms of their times, we all know that time is money, is only 67%, while male provide their time only 33%. But then when we come to the real deal, that's where our interest me into the organization that I'm working on, of which, if you can go to the next slide, yes. Now, we have seen that women take a very big part in contributing to agriculture sector in Tanzania. When we talk about access to resource, when we talk about resource here as agriculture, we refer to land. According to the open data that we have currently, the landlord, when we talk about women, it's only 27% compared to male. That means the landholder here in Tanzania are male dominated compared to women who spend much of the time in the farm doing production and making sure that it's happening everything there in the field. And another slide, please. Again, we see that there are women here in Tanzania, according to the open data, is that they don't have access to land. They don't have access to land, but not only that, when we talk about marketing is whereby when we talk about agriculture, is where money is involved. The involvement of women, according to open data, especially in agriculture marketing, that is selling, is very low, whereby according to open data, it shows that female participation during marketing, selling to what they have labored for a season in agriculture, it's only 20%, while male are contributing only 80%. And especially when we talk about this, since is mostly in Tanzania is a male-dominated society, we see that money is only for men. So even when it's come to agriculture, the same story is being imaged, whereby during marketing, it's only we see a large of male involved in marketing. So women will continue to do our domestic chores as always, because we are backside people compared to male population. And apart from that, next. Now, in Tanzania, I want to talk about how agriculture is structured, that farmers, especially who are doing subsistence farmers, are required to be organized in small groups that we know they're commonly known as farm organization. Talk about farm organization, we have AMCOs, we have SACCOs, we also have produce organization. Now I talk about under this organization or communities, whereby these farmers, they always get input in time, as well as provide several services from marketing actors. But when you see that during, when we talk about in Tanzania, in the aspect of farm organization, involvement of women is very low or is very limited compared to men. And according to the data that we're having, I will talk about this farm organization group in terms of the status of women in the membership. When we talk about membership, how women are involved in this farm organization is only 30% compared to male, whereby according to the project that we conducted the past 3 years, we saw that male members were almost 70% compared to female, who were only 30%. And not only that, and talk about management of this farm organization, talk about AMCOs, CBOs, as well as SACCOs. Women are very less engaged, whereby when we talk about this management, we saw that it's only 25% of women that are involved compared to male, whereby when we talk about the data that we have, it's only 75 management of farm organization that are male dominant compared to female. And not only that, another thing which is also very interesting, that is going to talk about how many decisions are made under this farm organization through board, because most of these big farmers organization, they also have a board where they decide what things need to be done in a certain farm organization. Again, participation of women is very limited, whereby according to the research that we made and the project that we did, it's only 30% of female who are involved as a board member to several farm organizations. And not only that, again, males still continue to be dominant, whereby a lot of board members are, when we talk about male dominated, that means even in the decision making and at the board level and in the farm organization still is dominated by male compared to female or to women. Next to that. Now, after seeing that the data that I presented earlier, my organization thought that it's high time for us to do something to empower or to engage more women in farm organization. Whereby I love what Raya said, that we can also do changes in the community, especially through training women's, especially at the village level, whereby through the legal clinic that I'm running, we managed to train almost 201 farm organization, of which we gave them legal knowledge on how important to consider the issue of gender in whatever they do, because it's part of them and it's very important for them to do so. So after our training since last year, we saw that there are some development that they have been made, whereby until to date, the data that we have in here is that it shows that membership has increased a little bit. For us, we see it's a success, because from 30% now, we talk about member status of women in farm organization, we have gone to 40%, of which again, male remain to be 6%. And not only that, we did a very capacity building on involving women in making decisions, of which we also we were able to, again, to increase the number. Now, when we talk about the management level and the farm organization, we have 30% vis-a-vis 70% of male in the management level farm organization. And not only that, we also made some efforts in the board to make sure that even more women, and talk about women also include young girls to be involved in management level through our training on commercial legal knowledge and how farm organizations are supposed to live according to the law. We're able to increase the number whereby up to now we see that the status of women supported under farm organization, when talk about boardship, women cover 35% and as well as 65% is still covered by men. And how do we do it? Is that after getting this statistic, we thought that is very important, whereby we conducted capacity building to all farm organizations that we engage, that is 201, whereby in their legal training, we empower them and we're reminding them, and we also assist them to restructure their legal structure and ensure that women are involved. And not only that, we initiate and ensure that the 201 farm organization visited by my clinic were assisted to be provided with a gender policy. So when we talk about gender policy, it's also formed part and parcel of their operational manual. That means whenever they make decisions, they need to have some operational manual. So we assist these farm organizations, which before our intervention, they had none of the gender policy, but we are happy that where we have passed as Lighthouse, we enable them to have a gender policy to ensure that gender is something that is doable and they can learn and start living with it, because you cannot have success if we are not gender balanced. So for that, I can say that thank you very much. It has been a blessing to have you, and welcome to Tanzania. Thank you.
Wow, Teresa, very powerful story around the full arc of collecting and looking at the data and analyzing it and using it for advocacy and policy. Really glad that we have the lawyers in the corner. It's not just the civic tech folks. So thank you for that. It's really important to have all the skills at hand. And I think that you can see a whole arc of the network that's here on this event today. We have data practitioners, we have people who are working in their civic communities to change and to train. We have legal mechanisms, we have researchers, and we have funders and donors. I think that's just really super powerful. Now we have our last speaker, Mahidia, and please tell me I pronounced that right this time. Mahidia? Mahadia. Okay,
Yes.
Everyone after me, repeat it in your head. Mahadida. I'm sorry. Please go ahead.
Sure.
So happy to have you here.
Thank you. Likewise, I'm so happy to be here today. So my name is Mahadia Tunga. I'm co-founder and director data science research and capacity development at D-Lab. But I'm also assistant lecturer at the University of Dar es Salaam. I'm also coordinating the Resilience Academy for the side of University of Dar es Salaam College of ICT. I'm also a data science PhD student, Women in Data Science ambassador and initiative by Stanford. I'm also a project manager for Code Like a Girl program sponsored by Vodacom. So I wear different. I wear so many hats, but gender equality.
Okay.
Hello, can you hear me?
I can. We kind of just a little bit there. So I'm going to keep myself off mute and please go ahead.
Oh, okay. So that slide has, yes. Yeah, you can just do that again. So open data and inclusion. So I know open data has already been defined, but I wanted to focus on the report produced by Web Foundation, which states like, which goes by the title is Open Data Working for Women in Africa. So that's where my presentation is going to focus on. So as Raya and others explained, that open data is the data that made available for anyone to access, use, and share. So with more access to open data, people can help shape more sustainable future with evidence-based solution. Just go next. Just next.
Yep.
It has transitions. So
Okay.
yes, that.
Oh, okay, go ahead.
SUZA helps community to develop gender sensitive approach, as you have seen on the Raya presentation, on the female genital mutilation focus, on the agriculture focus. So here I want to stress on the importance of having doing informed decision based on the available data. And what we are struggling is that, especially on the African side, we don't have enough data, but with the data that we have, it's also not gender disaggregated. So it's a challenge. So that affects the decision that we have to make. Next. So just go next, and then I'll tell you. Yeah, there it is. So what are the barriers? So I wanted to here also to discuss what are the barriers to open gender data, especially in Africa and Tanzanian context. So most of countries in Africa and obviously in Tanzania lack an open data culture and have legislation and processes that are not gender responsive. So lacking that open data culture makes that few countries have open data policy and initiative at the national level. Like in Tanzania, once we had open data draft, I remember even DLAB participated in the open data draft, but at some point as a country withdrew from open data, from OGP. And also I remember also 2 years back also the World Bank project on open data ended. So you find that since we don't have that culture, it's always that we depend on the external forces to open up our data. So once the projects are ending, we don't we don't continue with initiative. So most of the time the whole idea of open data is tackled as pilot project, which are never taking off. On the other point that I wanted to talk on the barrier to open gender data is the fact that research on open data, especially on the gender data, is inclusiveness is insufficient. You find that there is lack of funding on the research, especially when coming to the gender data, but also we lack the collaboration. So it's not a community initiative where it brings people from different perspectives, but it's just becoming organization initiative, and some other time it's just a project initiative. Once the project ends, the projects are never scaled. So that becomes a barrier, especially to open gender data. Next. Next. Yeah, there. So the other barrier to open gender data is the cultural and social reality, create additional challenge for women to engage with data and participate in the technology sector. The report by Web Foundation states that 1 gigabyte of mobile data in Africa on average could cost like 10% average of monthly income. And you must find, this is very high cost. And we know that women earn less, even in Tanzania. So that means most women are offline. And this is even supported by DHS data of 2015-2016 that was presented earlier by the speaker. And with that means these days we talk about big data, a lot of data being collected, but with this, since women are not online, that means we have less data about women. So that means whenever we are making decisions, we should also understand that. And And also over 90% of data set in sub-Saharan Africa are closed and not sex disaggregated data. Just go next. Yeah. So I know some of the speakers have spoken on the role of open data in gender equality. I just want to stress that the role of gender equality, the role of open data in gender equality is to quantify, is to give the magnitude of what we want to advocate for. We want to know exactly on the unpaid labor. We want to know exactly the statistics of gender pay gap, gender digital divide, women time poverty. We want to know about the literacy gap. So without having this data, we'll be making assumption in our intervention. Yeah, go next. Next. Next, sorry, I have animation, so just go next. I think
there's a delay of some kind, my friend. Every time I hit next, it's not going, so.
Yeah, and I can imagine because I think what comes is the figure.
Voila.
Yeah.
I feel like it's 10 to 1. 10 times I hit it, then we'll get it. But anyway, here we are. At least everyone's awake, right?
Yeah, sure. Thank you. And yeah, so open. So for the report by Web Foundation shows that that those are the percentage of the statistics of data that is gender disaggregated or national statistics. Health-wise, we see only 60% of data. So even when we talk about health interventions, that means are not representative of the situation that is available and are not targeted, because we are missing 32%. When you talk about education, when you talk about crime, which we have very little data, and we do not talk about other sectors where we have less and less data. So it's quite a big challenge having not gender disaggregated data. Next. And so so this was supposed to be who should advocate for gender data. So so oftentimes we think that it's the government role, but here I wanted to stress on the fact that us as individuals, we need to champion the open data by starting with our own organization, our own initiative, making sure that the data that we collect is available online, and it's not only available online, but we under open license and under the format that people could use. So I just wanted to stress that this is not, we shouldn't always point fingers to the government, to the donors, etc. But us as researcher activists, we should be at the front line sharing our own data. Next. So these are just few tips by me, how to advocate for gender data. So at the organizational level, I think it's important to ensure that we have top leadership. We have a champion, a top leader who is a champion. When we have top leaders as a champion, or when we are able to engage the top leader in our organization, it's easy to clear the path. We can see in Tanzania, I remember the former president, he was championing the open data initiative, and you would see how others at the bottom would take action. So even at the organization level, we need to have top leadership as a champion. Also, we need to start simple, because it's always the issue of openness. Always the issue of openness is sensitive. So when we are adding another layer to opening up gender data, so that is also an additional step. So it's always important to start simple, by very simple data, starting disaggregating it, and then we can build and culture and reach our targets. So, and we should always remind that quality improve when the data is open. We should be able to build capacity on the using of gender data. And I like the previous speakers also have stressed on this point, because they need to understand the value for them to be on board. Making the data easy to understand, and we should also engage the demand side so that they should be able to see the value of the data that we are opening up. We should also engage other activists who might need that data to use that data, because opening up the gender data is one step, but using that data is also a next step. Next. Yeah, so this is the key takeaway from me. Open data has a potential to change politics, economics, and society for better. To realize the full potential of open data, data must be accessible and used by all people. That means it must be inclusive to be able to be used by all people. Thank you.
I'm just sharing your screen so that you can see how to reach media. So next, what I thought we could do next is just take a moment. We've heard from some incredible people, you know, and one thing that I would say, just to build on Mahida, I'm gonna get it, I promise. To build on Mahida, it is leaders like you and advocates like you that makes open data possible. It is a hard go sometimes to get people to believe and to follow and to support. So just congratulations for all the efforts that everyone's doing, those that are speaking and those that are doing it here. Open data is something that can help all of our shared journeys. So with that, I know we can't physically clap, or you can't all get off mute and clap, but let's just think of yourself as giving a round of applause for all the speakers. If we're in the room, that's what we do, just really honor them. It's really hard to put yourself out there on a Saturday, it's late at night in Tanzania and Zanzibar. So just thanks to our speakers and early in the day. So now we know you might have questions. We also have some questions too. So we do have about 45 minutes left in the event for today, but know that if you do have questions, please do put them in the chat. But I'm going to kick it off with and just remember, my speakers, you probably have lots of questions for your own allies. And I think what Janet has done and just to end this network, what's really beautiful is that all of you should stay in touch afterwards, because you are the network that's going to help make that happen. And just again, really warmly glad to learn some more things about Tanzania and the work that you're doing there. I feel really excited to have an update. Many years ago when Phosphor-G happened there, I was able to meet a bunch of girls who were involved in the Tanzania Development Trust work. And they had come, some of them had taken buses for a long, long time to come to Dar to meet mappers from around the world. And they talked about like 11 hours, 12 hours, one day. I kind of sat back and I thought, wow, you know, 10 years ago when I got involved in mapping, I had no clue that it would touch and reach so many people's lives in the way that it has, and give them so much power to do that. And so I feel like you're my teachers, and I'm going to get all verklempt. So I'm going to go do the professional thing and ask some questions. But just warmly, first to Revi, is the gender digital divide getting bigger or smaller? We've heard some examples from agriculture, from health, from, you know, what happens when a pilot closes. We have to go beyond pilots, as Mahida said, you know, we really need to get further. So what's happening in Tanzania, and is it getting bigger or smaller? Revi?
That's a great question, and it's one that I like to pose all the time, because it really depends on what your data source is. You have like the ITU broadband report saying that there is, you know, a growing gap, especially in places that are, you know, more conservative, more populist, et cetera. As the world gets, you know, a little scarier, a little more threatened, obviously power relations come in and affect internet usage. And for some reason, empowered women are terrifying to the status quo. At the same time, you have some of the, you know, GSMA statistics that show that women's mobile internet use is up in certain areas. So this is why we need the data. we simply do not have a good sense. I mean, we obviously know there is a large gender digital divide. It is certainly played out in agriculture, which is probably the space that I'm most familiar with right now in terms of stats. And at the same time, we have very differing stat databases. And so I think this is a huge problem. And when you look at things like the census that's coming up in Tanzania, et cetera, this is a great time to really put the right indicators in and the right questions so that we get the answer to this. Like I said, going back to that community where 30% of the women could always use a phone and 30% always have to ask for permission. I mean, that was in Dar. Yeah. So this is where, I really hope that Tanzania can put together a really good set of indicators to really measure this gender digital divide and some of the empowerment economics that build on top of that. But of course, that depends on how good the indicator and questions are. So let's see.
Wonderful. And that's going to, in turn, also take some advocacy, right? We can come in and say, I'm from Northern Canada. I've only been to Tanzania, and actually, just to be super clear, I only went to Dar. I don't have a lot of understanding of what indicators are useful and how to negotiate that. That's why you need each of you to do that. So really excited to hear what your journey is. I'm going to turn to Raya and just ask her a question about how do you feel about the regional ambassadors within the Youthmappers network contribute to ensure that female perspectives are better represented? So why do we need to have regional ambassadors, and how can they help? What are some of the things that they can do and have done to make that better? So over to Raya.
Okay, thank you. Actually, I'm working as a regional ambassador under the Everywhere She Maps initiative. So now we have a new initiative that has been launched, which helps to provide a network and opportunities to female mappers. So we are considering to include the inclusion part that Mahadi Tunga explained is very important, because if the GIS part is one of the STEM-related fields, and in the STEM-related field, especially in our area, it is seen as a male career. So most female are like afraid to take those kind of fields, including the GIS industry. So the Everywhere She Maps initiative gives ladies voice in the social system that is actively working against them. And actually we are working to create a platform that can be used to share success stories of the women that have been working into this industry, and also available opportunities, and motivate the young girls and women to work into this field, and should not be afraid into working into this field, because it is okay for a woman to work into this field. So it's going to give female training and exposure to the open data and to the geospatial industry in general.
Wonderful. Thanks, Raya. Now, mapping is my background, meaning that I'm not necessarily a mapper. I'm an organizer in the open mapping communities. And I just wanted to reflect on one piece of data. The OpenStreetMap Foundation and the OpenStreetMap community had a global survey, which 5,000 people responded to. Only 8% of women responded to that survey. This is another year where there's no women board members on OpenStreetMap. In humanitarian OpenStreetMap, and I was a previous board member on both humanitarian OpenStreetMap and OpenStreetMap, what I think each of you talked about is the importance of leadership, and why the mentorship and the leadership and the skills to do that are important, both locally, but my encouragement for all of you is, if you are nervous about being a global leader, you're already a leader. You're already here, right? And there are many of us who want to see you on boards, both locally and globally. And so, Raya, that's just my hope that the regional ambassador networks of it will help give that kind of deep tissue for the years to come, that women in geospatial will be more involved in their leadership of their organizations. So just warmly congratulations on that. So I have a lot of passion for women leaders. So I'm going to turn on to Teresa now. Are there any kind of, now I know that ag tech is super important, especially when we're talking about climate change. everything I hear about ag tech and the attention on it is super exciting. And where I come from, people are hacking their tractors. I'm from Northern Canada, as I said, they're hacking their tractors to be able to own their tractors, to have the data so they can make decisions about their farming. So tell us, are there specific ag tech applications in Tanzania that women gravitate to? And I think this is really important because I think a lot of the software out there is made by men for men. And so how can we make sure that they're human-centered design? But more importantly, what are women using in Tanzania? Teresa?
Thank you. I think it's a very wonderful question. For the rate experience that I'm having is that only 30% of women access different legal tech. We do have a lot of legal tech, but then as my presenter just said, they're not mostly customized for women. They're not gender oriented like that. So they're too general. So what we're having, they're very limited. And since it's a new platform, especially thanks to COVID, last year we have seen a lot of transformation in agriculture whereby we have tried to go digital. So there are a lot of development that have been made and a lot of initiatives made by the government plus the non-organization and other market actors to ensure that at least there are those agri-tech that will provide services to farmers. But we don't have the popular ones that I can confidently share that with you guys and say that this is what we're having in Tanzania. Yes, we have, but they're very general and they are like, they're hard to find. As you say that in Tanzania, we don't have open data. So like, I cannot even get exactly what we have as a nation because Board of Statistics is very silent on that. When you Google issue about agriculture, they have either outdated information or very limited information. So for now, I can say that, yes, they are there, but very limited. Still on process, and as you say that thanks to COVID, that Tanzania were very rigid when talk about digitalization of agriculture activities. So as we move on, I think that the future is very bright, and we are going to accommodate, and we're going to encourage other marketing actors to dwell on the same and to ensure that we have those kind of agri-tech for women. Yes.
Wonderful. So I guess my question for Mahidia is who's going to build that? I think that the data scientists friends and the people who are, working with local communities, they have to join up, and civic tech communities do it all over. But Mahidia, you have a lot more window into what's happening in technology in your country. Maybe you can share some just reflections on what does that mean to have the data, and what about apps? Are there app development that you know about, or networks that are doing this kind of work? We'd love to hear from you on that.
So sorry, I just wanted to, can you repeat the question? Do you mean
Yes.
Can you repeat the question? Sorry.
I sure can. So she was talking, Teresa was talking about agricultural tech, and you were talking about data gaps. And I was just wondering, since you're involved in the civic tech community and the data communities in Tanzania, can you give a reflection on how are women getting involved in software to be able to have that kind of connection between data and technology? Any examples that you see or ways that you think that open data and tech communities can work together, or are already working together in your country?
Okay, yeah, I can talk about that.
Wonderful.
So at the college of where I am, at the College of ICT, sadly, only 30% who are graduating are women. So that's the challenge that we have faced. Though there are multiple initiatives now on targeting to involve more women. For instance, I'm running Women in Data chapter. We have Code Like a Girl initiative
right.
from the Vodacom. So now the move have shifted to catch them early, in a sense that catch them at early stage of their career. We might have not been successful at this stage, but if we try to catch them early, focusing on a program at secondary schools, focusing on program so that we can build an appetite for tech
related subjects so that eventually we have enough share of women. So that's what I have seen like a great move. I have few examples of people who we have trained in the Code Like a Girl program are now pursuing ICT subjects. And there are many more others like other programs. There's a program called Smart Girls, etc. So I feel like this move of trying to catch them early, change mindset at early stage is an important part to create that pipeline. Thank you.
Wonderful, thank you. So I think people who care about open data also have to care about open software. I know that's really hard and building software is really difficult, but I think that they're really good allies. And so how do we get the technology in the hands of people who are trying to do healthcare and who are doing agricultural interventions to be able to open up that data? Now they could use Open Data Kit, they can use Kobo, and frankly, my organization, we use that around the world, which is amazing. So instead of creating an app, what apps are out there? But I have to say, in the health groups that I work with in Malawi, they actually use WhatsApp. I know not everybody likes WhatsApp. Some people use Telegram or Signal, and that's how they share their data and their information, depending on the flow. So we have about 30 minutes left, and I think there's one more question in the chat. Then we're going to have breakout groups, which we'll tell you about, and we'll get Janet to tell you about what conversations we're going to be having. I'm putting Janet on the spot, so just giving her a pre-warning. So the question comes from Monica. What are the current challenges in utilizing this data for FGM? For community level programs and interventions and policy implementation. So who would like to answer that? What are the current challenges in using this data at the community level?
I think that should be for Annemarie.
Annemarie, tell us. Thank you.
And then maybe Naledi or others can maybe.
Okay, great. Yeah,
so one of the things and we in the field of FGM are really struggling with is that the DHS and mixed data is based on self-reports. So women report themselves on their FGM status. And especially in a country like Tanzania, where there is a law against the practice, of course, the question is how reliable are the results of the data that we gather. So that is really a challenge. Another challenge is that the latest DHS was done in 2015, 2016. And of course, that data is already quite old. And there's been so many incredible initiatives in the field in the past decade, but it's really difficult to measure the success of those projects and of the education and awareness raising campaigns and all the work that has been done in the field. So those are really challenges that we currently have. There are some very innovative methods of indirect methods of asking women and girls about their FGM status, for example. So there are some really nice developments in that sense, but in order to have like nationally representative data, those are really small scale case studies. So that is quite difficult. So we actually, I would say that those are the two main challenges that we have with the FGM data at the moment. So it's outdated, it might be biased. We don't know whether the results are credible and how to use it.
Wonderful.
Maybe I see some people nodding, so maybe other people want to share experiences as well.
Yeah, I think it really is about trust within the local communities. And, you know, data is about people. I keep saying this, but I think, you know, if the trust of the data of the communities is there, then you can work on your data flow, right? But there's a lot of other things. And I think Theresia just pointed out internet access. This is brought up by a couple of you. With no internet access or too much cost, then the data is unequal, right? And data is about power. And so we have to think about the whole pipeline of technology, the digital and data divide, and then the literacy, and most importantly, the safety and privacy of the people that we are here to help. Does anybody want to comment as well around FGM and data and how to programmatically work on that? Maybe Janet or some other colleagues just before we go to breakouts, or should we go to the breakouts now? Your choice.
I think breakouts, because we haven't got so much time left.
Okay. Wonderful. These are very deep topics, and we could have like 2 hours and workshops on all of these topics. So just I know that Janet's going to be providing the slides later. So just know that you can reach out to all the speakers. They've been able to give those slides available, which is fantastic. and then you'll be able to contact everybody and ask questions. So if you haven't used Zoom before, there's a feature called breakout rooms. So I have enabled the breakout rooms. We're going to have 3, okay? So in one breakout room, Naledi is going to be doing a presentation specifically on visualization and how to visualize data. And then Raya is going to be in a room talking about mapping. And we're going to stay in plenary for those of you that just want to chit chat too. So we want to give you options. So just to say, in order to do that, at the bottom of the screen, there's a little button that says breakout, and you can select which room you want to be in. If you are having problems, Janet and I can help put you in the rooms, okay? So what you do is you click, there might be a little button that says more. So you click on that little more button, and then you'll see that there's breakout rooms and you can go there. So for Raya and for Naledi, I want to make sure that you go into those rooms so that we can help you get set up. Is that all right, Raya? Can you help me, advise me if you're able to get into the room?
Yep. Yeah.
Okay, perfect. Perfect. See you. All right. Anybody else need help to go into one of those 2 rooms to have a small conversation, maybe a presentation on the topics? Thank you so much.
And just to say, the leaders of the breakout rooms, if they can also record them, that would be great.
Here, let me send a message to them. You actually, I think Janet, yeah. Okay, 1 second. Let me message them, okay?
Well, I can go into the
Here, I'll send her the message.
Can I go in the visualization room or not?
You can go to any room. You should be, if you click on the breakout button, Janet, you should be able to go to the room that you want to go yourself. So what you do is you put your name over visualization, you put your cursor over visualization and click join, and it'll let you go right in there.
Thank you.
No problem. I can help anybody get into a room if you just.
Oh, there's Janet.
Hi. Seemed to take a long time to get in. But so can you share your screen, Naledi?
I think it's going to be Benedetta who's going to be
okay.
Mostly.
Yes.
So I'll jump in with some introductions. So you've already, obviously, I've already introduced myself, and I wanted to give a really quick background on what we're going to present to you here in terms of, so I met Janet about a year ago, a little bit over a year ago. She got in touch with me about some of the work that I was doing for the charity that I was working for. At that point, I wasn't working for them anymore, but I was really interested in her project. So we met for coffee and talked a lot about her analytics needs. And I decided to get involved and to support with her data collection efforts and making use of that data. But I knew that it was a lot of work that we were going to have to do. And so I contacted Benedetta, and I'm going to leave it to Benedetta to introduce herself and to explain why I contacted her.
Sure, thanks, Naledi. So hello, everyone. I'm Bene, and I work for the Information Lab, which is a consultancy based in London. So I'm in office headquarters in London, and we are specialized in Tableau and Alteryx. So Tableau is a software, I don't know if you any of you is familiar with, but it's a software that allows to visualize data in a very effective way, and Alteryx is a software for data cleaning and data preparation. So Naledi and I used to work together, and when she left, she always worked for organization like she presented before, Fistula, and then she helped Janet. So we always collaborated because I'm very interested in the NGO sector, especially because we have lots of consultants. So we have a program which we train people in Alteryx Tableau, and then we work for corporates. So we always wanted to share this huge amount of skills for NGOs as well. So I was always one of the people contacting NGOs and try to redistribute these skills as best as we can. And last year let me share my screen. Oh, host disabled participant screen sharing. I'll just keep trying until yeah.
Try now.
Yeah, perfect, thank you. Yeah, can you see it?
Yep.
Perfect. So 1 year ago, we started with TIL+, which is our NGO channel of the Information Lab, which is our company, which is an initiative which we help NGOs and non-profit to make sense of their data. What we did for Janet, so Janet is the featured founder. So what we did for Crowd2Map Tanzania, if I click more, we have done a bunch of visualizations, data cleaning. So what we are trying to do is, again, to help with data, and one of the data is the DHS, which I'm gonna show in a second, to visualize FGM in Tanzania. And one dashboard, which is the one that I'm gonna break down in a second, is this one. So it's an overview, a snapshot of FGM in Tanzania. As you can see here is 2015-16 DHS demographic and health service data. And what we have tried to do is to display the breakdown in Tanzania, in which regions is prevalent. So we have in this region that 64% of respondents have experienced FGM and so on. What I'm going to do is to open this dashboard in Tableau and show you some of the charts and how to create that. So we have a little hands-on session. Please jump on anytime. I'm conscious we don't have much time left, but feel free to ask questions. And Naledi, please jump in as well. So as a quick overview, we had almost 10,000 total respondents. So we had 10,000 people doing the survey, and 10% of this group of people experienced FGM. Then we had other metrics. So for example, we had type of FGM experienced, and we had each person answering yes, no, and don't know. Let's actually jump on Tableau and I'll show you some of the charts and how I made that. Any questions so far?
I just quickly wanted to say a little bit about the background. Actually, Annemarie, you are probably more of an expert on this DHS data than we are, because we've only worked with it here. But for anybody who isn't familiar with the DHS data, it's partially open, but for some of it you have to apply in order to get access, if you really want to get access to the row level information. And I've done that in 2 cases, and they were really quick about getting back to you. Just have to outline what your research purpose is and why you need the data. And then we also sent them the visualization when we were finished with it to get approval to share this. So DHS data is super rich, really impressive. And to kind of explain, so we downloaded the DHS data, and then we used Alteryx, which is a data preparation tool that allows you to build up workflows to do the same processes in a repeatable manner. So if we got a new set of DHS data, if this is from 2015, 2016, if the newer data had the same questions, we could download that and with just one click, do exactly the same cleaning process and get it to the right shape. So we reduced it down to just the questions that we were interested in for this dashboard, and only brought those into Tableau. So I just wanted to give that quick background, because I think, and that's also why I wanted to talk about how about Benedetta's involvement, because I know that charities might want to use open data, might want to do their own analysis, but they don't necessarily always have access to the right skills or tools. And so having people like Until Plus to be able to support through that and actually explain that there's a lot of free resources out there, or really low cost resources that can really help you and your charity have a much larger impact and also save money, I think is really important to sort of provide some contact details there. So handing back over to you, Benedetta.
Yeah, absolutely. Thank you, Naledi. And also I had the Tableau starting kit here. So if any of you is interested in starting Tableau, first of all, there is that we obviously provide some volunteering work on the topic, but also there is a Tableau Foundation. So Tableau Foundation, you can also apply for a free license. So Tableau is going to sponsor you. I think Janet has got one of the Tableau licenses. So
they're not totally free, but they're much cheaper.
Yeah, you had to pay like $60 taxes, something. Yeah. But usually a donor can pay for that. So Tableau can pay for that, or maybe not, clearly not always, which I thought that was the case. But anyway, yeah, so Tableau Foundation has access to even a bigger amount of volunteers if you want some support. And also there is a Tableau starter kit for starting learning Tableau. So going back to the visualization, again, conscious of the time, I'm gonna quickly show you some important, very few initial steps. So for example, on the data source, so the bottom left, we have the data, which is a very important starting point to understand how are the data structured. So in this case, we have case ID. Again, our best of our understanding and knowledge of the data. That's the first step, understanding what are the data, what each column means. So we assume that each case ID is one person which has filed. So for example, in this case, we have one case ID, but we have 2 rows of data. So we were talking before about the data quality, the importance to understand, because people collect data is not always mean that the data correct or in the good form. That's exactly the first thing something should think about when analyzing data. So the very first thing you want to do when you have a data set is understanding the number of rows. So the number, for example, in this case, we have case ID. So I want to count how many respondents I have on my survey. So if I drag my case ID over here, I'll see that I have a number of case ID, and over here I can see on the very bottom left 9,721. And if I convert this case ID on count distinct, it's gonna count for me the number of case ID which correspond to my number of respondents. So I know that my survey was responded by almost 10,000 people. So if I drag this here on label, I'm gonna have my number over here. Now, if you remember, my second number was representing the number of respondents which have also experienced FGM. So how do we get to this number? So if I go back to data source, there are 3 columns, which one is flesh removed, genital area just nicked, or the third one. So 3 columns which can suggest that this person have experienced FGM. And so as you can see, they can be null if the person hasn't answered. It can be no, can be I don't know, or don't know, probably is equal to null, and then yes. So in my case, I have created a calculation which states if flesh, so this column is equal to yes, or the genital area just nicked without removing any flesh is equal to yes, or the last column is equal to yes, means this person is likely to have to have been through FGM. So I just say then yes, give me the case ID, otherwise null, because then in this way I'm able to count how many respondents have been through FGM. And that's exactly the case. So if I, just to show you quickly, if I have case ID, and then I go next and I put case ID, some of them are null. So in this case, this person, this case ID has been through the FGM, because then one of the 3 columns, if it makes sense, was equal to yes. And if I turn to be a count, and again, this to be a count, I'm gonna have 2 numbers. Just gonna put here and here. So it's 960 and over almost 10,000 records. And if I turn this to be a percentage, I wanna create a new column, which is say count of case ID over, no, the contrary, count of FGM over count of case ID. And this is gonna turn this to be a percentage. And I just quickly change the format. So it's just telling me that I have, again, 10% of my respondent to be experienced FGM, if it makes sense. Now, everyone loves maps. So let's create our lovely map over here. So if I go inside choose visualization, and again, another way to learn Tableau that we strongly recommend is to go through Tableau Public. So Tableau Public is a free platform where you have, for example, this one, my visualization is saved in Tableau Public. So you have access to loads of visualizations where you can just download and open in Tableau. By the way, Tableau gives 2 weeks of free trial. So if you want to like explore stuff and so on. So
there is just a free Tableau Public version, so you get the full program. The only limitations are that you can't connect to all the same types of data and you can't save anything locally. But if you just wanted to learn Tableau or build up your portfolio, if you're interested in going into data visualization or applying to a job as an analyst, then you can do that absolutely for free. And if you have any more questions about that, feel free to contact us.
We have one question.
Sorry,
yeah.
Do you know how often the admin boundaries are updated and whether it's possible to get district? I mean, these are regions, so if you wanted to break other data down by districts, how easy that would be to do?
Depends if we have districts inside the data set.
I think within, so, and maybe Annemarie, if she's still around.
She's not here.
Oh, yes, please. So maybe Annemarie, you can add to this as well. As far as I understand, some of the newer DHS data sources have more detailed locations in them, but at this stage it was only the region. And actually disaggregated data, or the lack of disaggregated data, is a huge problem, because a lot of times you do want to have things on the district level and understand, especially in the case like this, you know, where do you put safe houses? Where do you address, you know, where do you advertise services or support? Where do you focus your efforts on trying to solve this problem? You really don't need to have it necessarily on regional. You want to have it much more detailed than that.
Sorry, Annemarie, I thought you weren't here.
No, I'm here, and I can tell you that we did this exercise for Kenya, since the total number of women surveyed in Kenya was much higher than Tanzania. We were able to get more to a more detailed level at the county level even. So I now created a map for Kenya with FGM prevalence at the county level, which is much more detailed than any map that exists before. I had just one question, Benedetta, because also in the DHS, there is a question for women whether they have undergone FGM or not, and then they answer yes or no, and that might be easier than the way that you did it to see which type of FGM and then see how many women have undergone FGM. It's just a technical thing, but just for you to know that there is a question on FGM status in the DHS.
Right. Maybe we have filtered it out, Naledi, I'm not sure, because here I think it wasn't contained, but probably, yeah, because this is my calculation, but I think, yeah.
It's no problem, but just I should share.
yeah, please, absolutely.
To kind of add about the DHS, it is very, very rich data. There's a lot of questions that the respondents answer, so and they are actually very good with the documentation as well, but it is also quite a project to understand it initially.
But sorry, going back to the districts, for Kenya, if that data existed, does that mean in the DHS file there is the shape files for the admin boundaries then? Because I'm not sure that they're automatically in Tableau for Tanzania.
So Tableau provides integrated shape files for certain levels for different countries, and they go down to county level or city level for the US, very detailed. But for most African countries, it'll be just one level, it'll be the highest level. And I typically get my shape files from the Humanitarian Data Exchange.
Yeah.
And you can then import them into Tableau.
Thank you.
Benedetta, do you want to explain that?
Yeah. So what we have over here, we have a special object, which is created in Tableau through the region. So through the region of Tanzania, if I double click, Tableau automatically recognize which region is corresponding to which latitude and longitude. So as you can see, I have a generated one because Tableau is able to translate this region in a point. So as you can see, now each point it represents one region. It's going to be recognized at that level. And now if I drag percentage of FGM and I turn this to be a map, I'm going to have this. But also if I put the special object over here, And here we have just a slightly problem with the data, Tanzania. I need to focus on Tanzania. Now I have the same chart as before, where I have, as you can see, the percentage, and now I'm gonna turn the format to be a percentage. Is 0.63, so almost 64% of our respondent has experienced FGM is coming from this specific region. So yeah, very, very powerful way to obviously display the data, because it's quick, it's simple, and it's very intuitive way to display it.
Well, fantastic. I just have a quick question. Have you done anything similar in agriculture sector so that we can easily get to see how best we can the data available in agriculture? Or is only made for a specific needs, for instance?
You can use absolutely any type of data.
Okay.
Yeah, Tableau is a tool for any type of data, anything you want. And yeah, that's why I was encouraging anyone to download the free version and to use the Tableau Public one, and to start the starter kit is absolutely, I don't want to say easy to learn, but something I can say also pleasant to learn if you obviously want to visualize, because it's much easier in a way than many other softwares. And I think Naledi has been through many data visualization softwares, because obviously Tableau isn't free, as we were mentioning before. Yes, you can get a almost free license, but still lots of organizations prefer to use other type of visualization tools because they are free. But yeah, it's definitely something also for your own use. So Theresia, you were mentioning you would like to use it for agriculture and stuff. So definitely we suggest to download the free version and watch a couple of videos. YouTube is full of like free training. We run every week free trainings. And yeah, is a first of all, I would say Tableau, before the data visualization, for me is a data issue spot, because through the Tableau you can find really if your data are clean, and data quality in general, if your data are duplicated, or if your data, especially if you have many columns, if you have a huge amount of data, is way more easy to find problems visualizing your data than in an Excel, obviously, because imagine you have a huge amount of data, you can't really see it, if it makes sense.
Yes, and you did some brilliant work on the data that the safe houses and so on had collected via ODK as well. So that was really brilliant. Thank you.
Thank you, Jan. Yeah, so let me share another couple. Are we strict to 6, Janet, or can we carry on for a little bit?
It's totally up to you and everybody here. I have a feeling that Heather might be about to close the room, though.
Yeah, I can wrap up.
We're out in 60 seconds.
Yeah.
Yeah. Yeah, I can wrap up. I mean, I can show you like a couple more things quickly. So for example, on this one is data nicked. So over here, I'm just using one column. So it's very drag and drop tool. So just have a go again. And here is just telling me that 66% of respondent is I don't know, and then a yes, and then a no, and it's displaying the percentages. And bar charts is a very great way for comparing data. So, you know, when we're talking about comparisons, bar charts is one of the most efficient ways to do that, much better than a table, for example, because it's quicker, it's a more intuitive way to represent this sort of data. And a last thing I want to show you is
it's always exciting to be pulled back without your will. It's one of my favorite parts of Zoom. So how's everyone doing? Were you able to talk about all the things? Do you want more time? Wonderful, wonderful. So I think we lost a couple of people because it's the end of the day. Janet, what closing remarks do you have? And thank you so much for inviting me into this circle here. You're on mute.
Thank you, and thank you to everyone. It's been really fantastic to hear from everyone, and there's I think there's a lot of possibilities for going forwards and working together. So I really hope that we can take that forward. Perhaps even we can make this an annual event, so we can, this time next year, we can see how much progress we've made. I know that there were a lot of people interested in the visualization and so on, so that's, I hope we can do some more about that. I'm particularly interested to talk to, particularly to Theresia, who we haven't worked with, because agriculture is a huge issue, and the gender aspects around that. We actually have, and with Revi as well, because I know she's been doing some fantastic work about agriculture and the digital divide. There's actually Innovation Week in Tanzania at the end of March, 23rd of March, I think, and we are doing an event around agriculture for that. So I'm yet working out exact details, but that it would be amazing if both of you wanted to be involved in that. So thank you. I will send the recording and the slides to everybody, and we all have each other's contact details, I think. If not, if you want to be connected with somebody that you're not, then just let me know, and let's keep working together. And thank you very much.
Thanks, Janet. And thanks to all the speakers again, and for all the participants for staying. I know it's Saturday and it's a busy time. One thing that I would like to recommend is that this network's really special, right? And you need each other, right? And as Janet, just to reflect on what Janet said, you need each other. So by all means, have a once of the year kind of like powwow, or sorry for that, for a discussion in person, but maybe think about having a longer conversation around visualization or other things that the community connects. So talk to Janet about that. And if there's other ways that you should be connecting throughout the year and you want other topics around this and a deeper dive on it, I think there's a huge opportunity to connect virtually and just to kind of feel the care of people who really care about open data and open gender data, especially in Tanzania. So just again, warmly thank you for being part of this circle today. And I warmly welcome you to keep in touch and really just have a joyous rest of your weekend.
I want to add one thing. I mean, so we do, as Crowd2Map, we have a really amazing Slack channel. So if people aren't in that, I know quite a few people here already are, but if you're not in that and you'd like to be, then please let me know. And we could even put in a special channel that is specifically around gender data or something, and collaborate within that, perhaps might be a good idea. So
wonderful. And our tech friends can work on pushing Slack channels into other channels, other tools. So if you don't use Slack, you can have it pushed to email. So do know that you don't necessarily have to use Slack, but definitely keep in touch. And there's good ways to do that. We even have one in OpenStreetMap that pushes IRC in that to Slack. So let's just keep all connected. And again, warmly, thanks again. Bye.
Thank you.
And if you have your camera on, do wave, because it's so hard to be, you know, yeah. And I heard a baby crying earlier. I was so happy to hear a baby cry. I know as somebody who doesn't